What are the key stages of grief identified in Kubler-Ross's theory, and how do they apply to a hospice patient's family caregivers? Answer: Kubler-Ross's 5 stages of grief: denial, anger, bargaining, depression, and acceptance describe the emotional responses individuals may experience when facing terminal illness or loss. These stages are not necessarily linear, and individuals may experience them in different orders or revisit stages. For family caregivers in hospice care, these stages manifest differently as they may go through their own emotional journey while caring for a loved one. Understanding these stages helps hospice nurses provide emotional support. For instance, denial. Caregivers might initially refuse to believe that their loved one is dying, leading them to delay planning or make unrealistic hopes for recovery. Anger. Caregivers may feel anger toward healthcare providers, the illness, or even the patient. Bargaining. Caregivers may make deals with a higher power or engage in self-blame, thinking they could have done more. Depression. Sadness may arise as caregivers realize the loss is imminent. Acceptance. This stage represents a sense of peace where caregivers begin to prepare emotionally for the death of the patient. A hospice nurse is working with a patient who has been diagnosed with terminal cancer. The patient's family members are struggling with the diagnosis and exhibiting different emotional reactions. How should the nurse support these family members in a way that respects their individual grief processes while also ensuring effective communication and emotional support? Answer: in this scenario, the nurse should focus on individualized grief support by recognizing that each family member will likely experience grief in their own way. To effectively support them, assess each family member's coping style. Some may be in denial, while others may feel angry, or some might seek to bargain. The nurse should recognize these emotional responses as part of the grieving process and not as a sign of weakness or dysfunction. Provide a safe, non-judgmental space for expression. Family members need a place to express their emotions freely. Listening attentively without interrupting or judging their feelings is crucial. Validate their emotions. It's essential to acknowledge their feelings and reassure them that their emotional reactions are normal. Offer information and resources. The nurse should provide information about the illness and death process in a way that respects the family's readiness to hear it. In addition, referring the family to grief counselors or local bereavement groups can help encourage open communication. Help the family discuss their concerns and feelings with each other to strengthen their emotional support system. What is the role of bereavement assessments in hospice care, and how can a nurse effectively use them to guide interventions for a family experiencing prolonged grief? Answer: bereavement assessments are essential tools for evaluating the grief process in family members and ensuring they receive appropriate support. These assessments typically evaluate the severity of grief symptoms, the duration, and the impact on daily functioning. For family members, hospice nurses use these tools to identify whether their grief is complicating their ability to function and whether they might benefit from specialized interventions. A nurse can use tools like the Grief Assessment Tool GAT, which focuses on emotional and behavioral aspects, or the Inventory of Complicated Grief, which helps identify complicated grief symptoms that might require more intensive support. If the assessment indicates that a family member is experiencing prolonged or complicated grief, the nurse can refer them to professional counseling services. Offer grief-specific interventions such as cognitive behavioral therapy (CBT) or support groups. Educate the family about the normal stages of grief while discussing how long-term grief may lead to complications like depression or post-traumatic stress. Reassure the family that grieving is a personal journey and support is available. Mr. Jenkins is the primary caregiver for his wife, who has advanced stages of Alzheimer's. He is struggling with feelings of anger and resentment toward her for needing constant care. He feels that he is sacrificing too much of his own life and is overwhelmed with the burden of caregiving. What can the hospice nurse do to help Mr. Jenkins navigate these feelings, and how can they address the ethical considerations involved in this situation? Answer: in this case, the hospice nurse must provide compassionate support while addressing Mr. Jenkins' emotional and practical needs. The nurse should acknowledge his feelings. Mr. Jenkins' anger and resentment are valid emotions in the caregiving process. Provide respite care options. The nurse can recommend respite care services where Mr. Jenkins can take breaks from caregiving, which might help alleviate feelings of burnout and resentment. Encourage participation in support groups. Grief and caregiver support groups can be an essential resource where Mr. Jenkins can meet others in similar situations and share coping strategies. Discuss coping strategies. The nurse can provide coping techniques such as mindfulness practices, deep breathing exercises, or even engaging in hobbies outside caregiving to relieve stress. Ethical considerations. The nurse must remain non-judgmental and respect Mr. Jenkins' emotional journey while maintaining his autonomy. Encouraging Mr. Jenkins to care for himself while continuing to provide the best care for his wife is central. How does research in hospice and palliative care contribute to improving the quality of care, and how can a nurse apply evidence-based findings to daily practice? Answer: research in hospice and palliative care plays a critical role in improving patient-centered care, quality of life, and symptom management. Research provides evidence-based guidelines and protocols that assist in pain management. Research identifies the most effective pain relief methods, including opioid usage, alternative therapies, and symptom-based treatment protocols. Psychosocial support. Studies highlight the significance of psychosocial care and family involvement in palliative care, improving outcomes for both patients and caregivers. Advanced care planning. Research supports the use of advanced directives, helping both patients and families make informed decisions about treatment options. A nurse can apply these findings by integrating research-based best practices into care plans, using established pain management protocols and evidence-based psychosocial interventions like cognitive behavioral therapy. Furthermore, nurses can participate in palliative care research to stay updated on the latest findings and contribute to the advancement of care practices. What are the main differences between normal and complicated grief, and what interventions can a hospice nurse implement to support families who exhibit signs of complicated grief? Answer: normal grief involves feelings of sadness, loss, and emotional distress, but generally decreases in intensity over time as individuals adapt. In contrast, complicated grief, also known as prolonged grief disorder, involves an inability to move forward, with symptoms that persist or worsen over time. Common signs of complicated grief include intense and persistent longing for the deceased, difficulty accepting the death, feeling numb or disconnected, extreme focus on the death, or intrusive thoughts about it. Interventions. Cognitive behavioral therapy (CBT). This therapeutic approach can help individuals restructure negative thought patterns associated with grief. Grief counseling. Professional grief counselors can assist families in processing unresolved grief. Support groups. These offer peer support, allowing families to share their experiences and learn coping strategies. Medication. In some cases, antidepressants or anti-anxiety medications might be prescribed to manage symptoms. What are the key ethical principles that guide hospice and palliative care practice, and how do these principles inform decision-making in end-of-life care? Answer: key ethical principles in hospice and palliative care include autonomy. Patients have the right to make their own decisions regarding their care. This involves providing information in a manner that is understandable and honoring their wishes, such as through advanced directives. Beneficence. Healthcare providers must act in the best interest of patients, ensuring that care is aimed at promoting comfort and well-being. Non-maleficence. The principle of do no harm is vital, ensuring that care interventions do not worsen the patient's condition or cause unnecessary suffering. Justice. Fair and equitable treatment for all patients, ensuring that resources are allocated appropriately and that all patients have access to quality care. In end-of-life care, these principles guide decisions such as whether to continue aggressive treatments or focus on comfort care. The administration of pain relief and the patient's right to informed consent for treatments, supporting families in understanding these principles and respecting the patient's dignity. What is the role of community resources in supporting patients and families in hospice care, and how can a nurse facilitate access to these resources? Answer: community resources play a crucial role in enhancing patient comfort and family support in hospice care. These resources may include counseling services for emotional support, respite care for caregivers to reduce burnout, spiritual care teams to address religious or spiritual concerns, home health aides to assist with daily activities, grief support groups to help family members cope with the loss. A nurse can facilitate access to these resources by assessing patient and family needs during the care planning process, referring to appropriate services based on the family's preferences, coordinating with local agencies, ensuring that services like home health aides or meal delivery are in place to assist the family. By actively connecting patients and families with these resources, nurses ensure a comprehensive care plan that extends beyond medical treatment, fostering emotional, spiritual, and practical support during the hospice journey. How can the application of evidence-based protocols improve the quality of care in managing symptoms such as pain, nausea, and dyspnea in hospice patients? Answer: evidence-based protocols in symptom management are central to improving quality of life for hospice patients. For example, pain research-based protocols advocate for opioid use, morphine, fentanyl, alongside adjuvant medications, e.g. corticosteroids for bone pain. Dosing should be tailored to the patient's level of comfort and regularly assessed for efficacy. Nausea, antiemetic protocols based on prokinetic agents, e.g. metoclopramide, and stimulant antiemetics, e.g. G. Haloperidol should be used based on the cause of nausea, medication side effects, or obstruction, dyspnea. Protocols recommend using opioids for symptomatic relief and adjunct therapies like bronchodilators or diuretics in the case of fluid overload. By applying these evidence-based guidelines, nurses can ensure optimal symptom management tailored to the patient's condition, improving comfort and enhancing the overall quality of hospice care. What role does cultural competence play in providing effective hospice care, and how can a nurse ensure that care respects cultural differences? Answer: cultural competence involves understanding and respecting the cultural values, beliefs, and practices of patients and families. In hospice care, it is vital for nurses to learn about cultural traditions. Each culture may have different views on death, grieving, and end-of-life care, e.g., preferences for spiritual rituals or family involvement in decision-making. Communicate effectively. Nurses must ensure that communication is respectful and culturally sensitive, using interpreters when necessary. Respect preferences. If a patient prefers traditional or alternative treatments alongside hospice care, this should be honored within the boundaries of ethical and medical practice. Ensure access to culturally appropriate resources. Nurses should identify community organizations that can assist with cultural or spiritual needs. Cultural competence improves the patient's sense of dignity and autonomy, fostering a more holistic approach to care during a sensitive time in the patient's life. What are the key components of a comprehensive palliative care assessment, and why are they critical in ensuring appropriate care delivery? Answer: a comprehensive palliative care assessment involves a multidimensional approach to understanding the patient's physical, psychological, and spiritual needs, which are all crucial to delivering individualized care. The key components of this assessment are: physical assessment includes evaluating symptoms such as pain, fatigue, nausea, difficulty breathing, and other symptoms that may significantly affect the patient's quality of life. Psychological assessment includes screening for anxiety, depression, or other mental health concerns, as these are common in patients facing serious illnesses. A mental health assessment helps tailor interventions that address emotional suffering. Spiritual assessment, as many patients face existential concerns, this component evaluates the patient's spiritual beliefs, practices, and concerns, facilitating respectful discussions about their meaning-making during illness. Social and cultural considerations involves understanding the patient's family dynamics, caregiving support, cultural beliefs, and preferences, all of which may influence treatment choices and preferences for care. The use of palliative care screening tools and assessment scales, e.g., the Palliative Performance Scale Edmonton Symptom Assessment System helps to quantify symptoms and monitor changes over time, which assists in making timely adjustments to care. How does cultural competence play a role in palliative care, and what are some strategies to incorporate cultural considerations into the care process? Answer: cultural competence in palliative care involves recognizing and respecting the diversity of values, beliefs, practices, and traditions among patients and their families, particularly when dealing with death, dying, and end-of-life care. This is critical to avoiding misunderstandings, providing respectful care, and ensuring that the patient's preferences are honored. Some strategies to incorporate cultural considerations include building awareness. Understanding the patient's cultural background through direct communication and education can help inform decisions about pain management, end-of-life rituals, and other care practices. Patient-centered care. Respecting patients' values by tailoring interventions to their specific needs, which might include dietary restrictions, spiritual practices, or preferences regarding family involvement. Language and communication. Ensuring that communication is effective and culturally sensitive, and providing language support, e.g., interpreters when needed. Mr. Thompson, a 67-year-old male, has been diagnosed with terminal lung cancer and is currently experiencing significant pain despite medication. His family insists on pursuing aggressive treatments, but Mr. Thompson has expressed his desire to discontinue treatment and focus on quality of life. What should the hospice nurse do in this situation? Answer: in this situation, the hospice nurse should prioritize open and empathetic communication with both Mr. Thompson and his family, ensuring that his wishes are respected while addressing the concerns of his family. The nurse should clarify Mr. Thompson's wishes, have a direct conversation with Mr. Thompson to confirm his preferences, ensuring that his decision to focus on comfort care is informed and voluntary. Address family concerns. The family may feel conflicted about stopping aggressive treatment. The nurse should use communication techniques to address their concerns, explaining the benefits of focusing on quality of life and the hospice philosophy of care, which prioritizes comfort and symptom management. Facilitate. A family meeting involved the interdisciplinary care team, including social workers, chaplains, and physicians, in a family meeting to align on the goals of care, providing both medical and emotional support for the family. This aligns with the Hospice and Palliative Nurses Association (HPNA) standards, which emphasize patient autonomy, family support, and shared decision-making in end-of-life care. Explain the importance of breaking bad news in palliative care and provide strategies to do so effectively. Answer: breaking bad news is a critical and sensitive aspect of palliative care that requires empathy, clarity, and a patient-centered approach. The goal is to convey the diagnosis or prognosis in a way that minimizes emotional distress while providing the patient and family with the information they need to make informed decisions. Key strategies include preparation. The healthcare provider should ensure a quiet, private space and be ready to offer emotional support throughout the conversation. The SPIKES protocol, a commonly used framework for breaking bad news, which includes S, setting up the interview, P, perception of the patient family, like invitation for the patient to learn more, care, knowledge, delivering the bad news, empathy, acknowledge the emotional response, that's the summary, help the patient family process and discuss next steps. This aligns with the American Society of Clinical Oncology, ASCO, and National Institute for Health and Care Excellence, NICE guidelines on communication in palliative care. What role do caregivers play in the palliative care assessment, and what considerations should be taken into account when assessing their needs? Answer: caregivers play a vital role in palliative care as they are often the primary source of support for the patient. Assessing their needs is essential for ensuring that both the patient and caregiver receive the support they need. Considerations include emotional support. Caregivers often experience emotional and psychological stress. Nurses should assess for signs of caregiver burnout, depression, or anxiety and provide resources or referrals as needed. Physical support. Caregivers may struggle with the physical demands of caregiving. Providing education on managing care tasks, such as lifting or administering medications, can alleviate physical stress. Social support. Caregivers should be encouraged to access social support networks, and the nurse may suggest community resources, support groups, or respite care. The National Alliance for Caregiving and American Academy of Hospice and Palliative Medicine (OPAM) emphasized the importance of supporting caregivers to ensure they remain capable of continuing their roles while managing their own well-being. How does effective communication with families enhance the delivery of palliative care, and what are the key challenges faced during these interactions? Answer: effective communication with families is essential for ensuring that care decisions are shared, informed, and aligned with the patient's wishes. The primary benefits include informed decision-making. Families need clear information to understand the patient's prognosis, treatment options, and goals of care. Emotional support. Families often experience distress and grief. Effective communication helps provide them with comfort and reassurance. Care coordination. Ongoing communication ensures that the care plan is understood and consistently followed by all members of the care team. Challenges include emotional responses. Family members may react with denial, anger, or guilt, which requires the nurse to navigate these emotions with empathy and patience. Cultural differences. Families from different cultural backgrounds may have varying expectations about care, making it crucial to understand and address these differences. Effective communication strategies include active listening, providing information in small, understandable chunks, and ensuring family members feel heard and validated. Mrs. Martinez is an 82-year-old woman with advanced Alzheimer's disease. Her daughter, who is her primary caregiver, is having difficulty managing her mother's increasing needs for care. What interventions might a hospice nurse suggest to improve the situation? Answer: in this situation, the hospice nurse should consider a holistic approach to address both Mrs. Martinez's care and the daughter's well-being. Interventions might include caregiver support. The nurse should assess the daughter's emotional and physical state, offering resources for respite care to give her breaks and reduce caregiver burnout. Referring her to a caregiver support group can also provide emotional support and coping strategies. Advanced care planning. The nurse should help facilitate a discussion about the patient's preferences for end-of-life care, ensuring that the daughter is comfortable with the care plan and feels empowered to make decisions. Symptom management. Assess Mrs. Martinez's symptoms, such as pain, anxiety, or agitation, and provide appropriate interventions, such as adjusting medications or offering non-pharmacological treatments like music therapy or guided relaxation. These actions align with the National Hospice and Palliative Care Organization (ATPIA) guidelines for family-centered care. What is the significance of family dynamics in palliative care, and how can a hospice nurse effectively manage these dynamics when multiple family members have differing opinions on the care plan? Answer: Family dynamics can significantly affect the decision-making process in palliative care, as differing opinions on treatment options or the patient's wishes can create tension. A hospice nurse should facilitate open communication. The nurse should encourage family members to express their concerns and feelings in a safe, neutral environment, ensuring all perspectives are heard. Empathy and understanding. Recognizing the emotional stress each family member faces can help foster a collaborative environment where disagreements are addressed with respect and compassion. Clarify goals of care. The nurse should reinforce the patient's wishes and explain the benefits of focusing on comfort and quality of life, helping the family to reconcile their differences. The American Academy of Hospice and Palliative Medicine, OPAM, highlights the importance of family-centered care in creating an environment of support and respect. Explain the importance of spiritual care in palliative care and the role of the hospice nurse in assessing spiritual needs. Answer: spiritual care is a fundamental component of palliative care, as patients often face existential questions about meaning, purpose, and their legacy as they approach the end of life. The hospice nurse plays a crucial role in assessing and addressing these needs by spiritual assessment. The nurse should ask open-ended questions about the patient's spiritual beliefs, practices, and concerns, integrating this information into the care plan. Collaboration with spiritual care teams. Nurses should collaborate with chaplains or spiritual care providers, ensuring that the patient's spiritual needs are met in line with their beliefs. Providing presence and comfort. For patients who may not have strong religious beliefs, simply providing a compassionate, non-judgmental presence can address spiritual concerns. The Nurses Christian Fellowship and National Consensus Project for Quality Palliative Care stress the importance of spiritual care as an integral part of holistic palliative care. What are some key strategies for managing grief and bereavement communication in palliative care, and how can the nurse support families during the grieving process? Answer: grief and bereavement are common experiences for families receiving palliative care, and the hospice nurse plays a key role in supporting them through this process. Anticipatory grief. The nurse should provide emotional support before the patient's death, helping family members process their feelings and prepare for the impending loss. Normalizing grief. After the patient's death, the nurse should reassure the family that their grief is a normal and necessary process, offering resources for professional counseling or support groups. Ongoing communication. Continued contact after the patient's death helps ensure that families have the emotional support they need, as grief can be a long-term process. The American Psychological Association, the PAT guidelines, emphasize the importance of continued support during both anticipatory grief and after bereavement. How can hospice and palliative care nurses effectively advocate for policy changes that improve patient access to care and services? Answer: hospice and palliative care nurses can advocate for policy changes by leveraging their unique experiences in patient care. Nurses should actively engage with legislators through direct communication, advocacy events, or joining professional organizations like the Hospice and Palliative Nurses Association, HPNA. Through these avenues, nurses can present data, case studies, and patient testimonials to support the need for better policies and funding. Nurses must be knowledgeable about regulations such as the Medicare Hospice Benefit, which outlines eligibility and reimbursement rates for hospice care. By advocating for the expansion of coverage, better payment structures, and improved access to care, nurses help influence policy decisions. Additionally, participating in state and federal discussions about healthcare access and quality can raise awareness about the importance of palliative care. Nurses must also educate the public and policymakers about the value of hospice care, focusing on the benefits it provides to patients and families. Nurses' involvement in policymaking is essential for ensuring that hospice and palliative care services are available, equitable, and patient-centered. What are the key federal and state regulations that affect the delivery of hospice care, and how do they impact nursing practice in this field? Answer: the Medicare Hospice Benefit under the Social Security Act is the primary federal regulation influencing hospice care. It outlines eligibility for hospice services, which are limited to terminally ill patients with a prognosis of 6 months or less. The benefit provides comprehensive care, including medical services, hospice nursing, and bereavement support. State regulations vary but often include licensure requirements for hospice providers, specific guidelines for care standards, and Medicaid eligibility rules for low-income patients. Nurses must be aware of these regulations to ensure compliance in patient care. For example, they must document patient eligibility carefully, especially when determining whether a patient meets the 6-month prognosis. Non-compliance with Medicare or Medicaid regulations can lead to financial penalties or loss of reimbursement. State-specific rules might also affect care delivery, such as requiring a certain number of visits by registered nurses or mandating periodic audits. Nurses must also be knowledgeable about the Patient Protection and Affordable Care Act (ACA), which expanded hospice care coverage and introduced quality measures to assess patient outcomes. Understanding these federal and state regulations allows nurses to deliver quality care while ensuring that hospice agencies maintain compliance and secure reimbursement. What are the reimbursement challenges faced by hospice providers, and how can nurses help address these issues? Answer: hospice providers face significant reimbursement challenges primarily due to the limitations of Medicare and Medicaid reimbursement structures. Under Medicare's hospice benefit, the reimbursement is fixed based on a per diem rate for care provided, which can be insufficient for certain high-cost cases. Another challenge is the 6-month prognosis requirement for eligibility, which can be difficult to assess, leading to denials or delayed reimbursements. Nurses can mitigate these issues by ensuring that the documentation is thorough and accurate, particularly in terms of the patient's diagnosis, prognosis, and the services provided. By accurately documenting symptoms and care needs, nurses help demonstrate the appropriateness of hospice care, improving reimbursement chances. Nurses can also advocate for improved reimbursement rates and policies by participating in professional organizations, pushing for changes in legislation that would improve financial sustainability for hospice providers. Nurses must also be proactive in managing the care plan and making necessary adjustments, ensuring that resources are used efficiently and effectively. Effective communication within the healthcare team and with insurers ensures that patients receive the necessary care while minimizing financial challenges for providers. Explain the ethical challenges faced by hospice and palliative care nurses in end-of-life care and how they can navigate these challenges while maintaining professional standards. Answer: ethical challenges in hospice and palliative care often revolve around respecting the patient's autonomy, providing relief from suffering, and ensuring beneficence, doing good while avoiding non-maleficence, do no harm. Nurses must navigate complex decisions like whether to provide aggressive treatments when a patient wishes for comfort care. For example, families may request life-prolonging interventions that contradict the goals of hospice care. Nurses must advocate for patients' wishes, ensuring they understand the implications of treatments and respecting their decisions. Nurses must also address cultural and spiritual considerations, ensuring that care is individualized and aligns with the patient's values. Additionally, the ethical principle of justice requires that nurses advocate for equal access to care for all patients, regardless of socioeconomic status or other factors. Professional standards, such as those outlined by the American Nurses Association on a Code of Ethics, guide nurses in maintaining ethical boundaries and providing compassionate care. Ethical decision-making tools, such as shared decision-making and consultation with interdisciplinary teams, can help nurses navigate these challenging situations. Nurses must also ensure they are well informed about the legal aspects of end-of-life care, such as advance directives and do not resuscitate DNR orders, to avoid conflicts while providing patient-centered care. Mrs. Allen, a 78-year-old hospice patient with advanced cancer, is struggling with severe pain management. Despite her doctor prescribing opioids, the pharmacy has been slow to fill the prescription due to concerns about potential abuse of controlled substances. Mrs. Allen's family has expressed frustration, and she is in significant distress. As her hospice nurse, what actions should you take to advocate for her rights and ensure she receives the appropriate care? Answer: in this situation, the hospice nurse should immediately contact the prescribing physician to verify the order and ensure the prescribed medication is appropriate for pain management. The nurse should then engage the pharmacy staff, explaining the patient's advanced stage of cancer and the need for effective pain management to alleviate suffering. Since Mrs. Allen's pain is severe and requires urgent attention, the nurse should explore alternative options if the pharmacy is unable to provide the prescribed medication promptly. This may include reaching out to other pharmacies or arranging for a temporary prescription modification to provide relief. The nurse should also educate the family about the hospice philosophy of care, which focuses on comfort, and explain the importance of timely pain management. Additionally, the nurse should reassure the family that their concerns are being addressed while advocating for the patient's right to receive appropriate care without unnecessary delays. By maintaining open communication and working closely with the healthcare team, the nurse ensures that Mrs. Allen receives the care she needs in a timely manner. Nurses must advocate for patients' rights to pain relief, especially in hospice settings where symptom management is critical to quality of life. Why is continuing education essential for nurses in hospice and palliative care, and what are the benefits of certification in this specialized field? Answer: continuing education is essential for nurses in hospice and palliative care to ensure they stay informed about the latest advancements in symptom management, pharmacology, and ethical practices. Palliative care, especially at the end-of-life stage, requires a deep understanding of complex medical, psychological, and spiritual needs. Nurses must keep up with research findings, new medications, and evolving patient care strategies to provide optimal care. Certification in hospice and palliative care, such as the Certified Hospice and Palliative Nurse EAP credential, demonstrates expertise and professional commitment. It increases a nurse's credibility, improves job prospects, and enhances career development. Certification also fosters a deeper knowledge of pain management, symptom control, and ethical decision-making, ensuring that nurses are equipped to handle complex clinical scenarios. Nurses with certification are often more proficient in providing high-quality care, which leads to improved patient outcomes. Additionally, it provides nurses with a framework for personal and professional growth, encouraging them to reflect on their practice and engage in lifelong learning. These continuous education efforts ultimately lead to better patient care, as nurses are able to integrate the latest evidence into their practice. What strategies can hospice and palliative care nurses employ to manage stress and prevent burnout in their demanding work environment? Answer: hospice and palliative care nurses are at high risk for stress and burnout due to the emotional and physical demands of providing end-of-life care. One essential strategy is self-care, which includes regular exercise, relaxation techniques, and ensuring adequate rest. Nurses should set boundaries to manage their workload and avoid overextending themselves emotionally. Time management is critical to ensure that nurses are not overwhelmed, allowing them to balance their professional and personal lives. Additionally, fostering a support network within the workplace, whether through debriefing sessions with colleagues or counseling services, provides emotional support and prevents isolation. Mindfulness practices such as meditation or journaling can also help nurses process their emotions and prevent emotional exhaustion. It's also essential to foster a positive work environment where open communication is encouraged and nurses feel supported by their peers and leadership. Continuing education can be a source of motivation and help nurses stay connected to their professional growth. By adopting these strategies, nurses can reduce the risk of burnout, maintain empathy, and provide high-quality care without compromising their well-being. How can reflective practice and self-care techniques enhance the quality of care provided by hospice nurses? Answer: reflective practice helps nurses examine their interactions with patients, identify emotional responses, and consider how personal feelings might impact decision-making. This process allows nurses to improve their professional practice by identifying areas for growth, reinforcing strengths, and enhancing their emotional intelligence. Reflecting on patient interactions helps nurses better understand their own emotional responses to difficult situations, such as managing end-of-life care, which can be emotionally taxing. This self-awareness leads to more empathetic, patient-centered care, reducing the risk of compassion fatigue and improving overall job satisfaction. Self-care techniques complement reflective practice by promoting physical, emotional, and mental well-being. Nurses can engage in activities such as mindfulness meditation, breathing exercises, or journaling to manage stress. Establishing a routine that includes sufficient rest, exercise, and healthy eating is crucial to maintaining energy levels and preventing burnout. Nurses should also seek professional support when dealing with particularly challenging cases, such as counseling or peer support groups, to discuss emotional challenges. Regularly participating in reflective practice and self-care fosters resilience, allowing nurses to continue providing high-quality, compassionate care without compromising their well-being. Why are professional boundaries important in hospice care, and how can nurses maintain them while providing compassionate care? Answer: maintaining professional boundaries in hospice care is essential to ensure that nurses provide appropriate, compassionate care while avoiding emotional over-involvement or burnout. Professional boundaries protect both the nurse and the patient by fostering a healthy therapeutic relationship. While empathy and emotional support are critical, it's important for nurses to avoid becoming too personally invested or letting personal feelings interfere with care. Setting clear boundaries involves maintaining a respectful, professional demeanor while ensuring that the patient's needs are met without overstepping personal boundaries. Nurses can achieve this by ensuring that their communication remains compassionate yet professional, focusing on the patient's needs rather than their own emotional responses. Additionally, nurses must practice self-awareness, recognizing signs of emotional exhaustion or attachment and take appropriate breaks to recharge. Seeking supervision or support from colleagues helps nurses maintain these boundaries and manage emotional strain. Adhering to professional boundaries ensures that nurses remain objective and provide the best care possible while preserving their own emotional health. What are the primary legal and ethical responsibilities of hospice nurses when caring for patients at the end of life? Answer: Hospice nurses have significant legal and ethical responsibilities to ensure that they provide quality care while respecting the patient's rights and dignity. Ethically, hospice nurses must adhere to principles such as autonomy, beneficence, and non-maleficence. Autonomy means respecting the patient's right to make decisions about their own care, including advance directives and decisions regarding life-sustaining treatments. Beneficence involves promoting the well-being of the patient by managing pain and other symptoms, while non-maleficence ensures that nurses do not harm the patient either physically or emotionally. Legally, nurses must comply with relevant regulations, such as the Patient Self-Determination Act, which requires healthcare providers to inform patients about their rights to make advance care directives. Adherence to Do Not Resuscitate (DNR) orders and respecting the patient's end-of-life wishes are critical aspects of a nurse's legal responsibility. The Nurse Practice Act outlines the scope of nursing responsibilities and legal boundaries, ensuring that nurses practice within the law. Furthermore, nurses must remain vigilant about the potential for elder abuse and fraud, reporting any concerns to the appropriate authorities.